Welcome back to Daytime. Everybody, with me now is Dr. Eric Rouah. He is the dentist and the owner of Aurora Dentistry, and also a good friend now. Because you as well are a Habs fan. Yay! Always room for more on the couch, sir.
Yes, absolutely. Where's the Boston jersey? We want to stamp on it a little bit.
Don't get me started. They're really political here.
Yeah.
Okay, so what I want to talk to you about is a lot of people don't always want to get braces. And we're talking about Invisalign today because braces, for some people, can seem a bit intrusive. You know what I'm saying.
Absolutely.
Invisalign is really the opposite, yes?
Yes. So just to show, I'm not sure.
Here, pass me that bad boy.
Yeah, absolutely. And I'll give you the tray so you can take it off like that.
So this is your teeth normally, right? This is what, well, if you're lucky, they look like that. But they don't all look like that. And an Invisalign goes on just like
yeah, and then you
that.
snap it on.
Boom. And you can't even tell. So why use this technology?
So basically, you know, a lot of adults like this technology because they don't want to wear braces. I mean, they have a product called Invisalign Teen, which teenagers can use, but I find that for most of my practice, it's mostly adults that have had braces and they didn't wear their retainer and then the teeth went back.
Or their headgear and
all that stuff, which, absolutely. So this is a great product in terms of it's invisible. You can't see it. I mean, and it acts exactly like braces. And basically what you do is you change the retainers every 2 weeks.
Okay.
So for instance, if your treatment is a year, you're going to get 26, it's going to be 26 aligners.
How does that work? Do I go in for a different mold every few weeks to get it updated? Or do you sort of just forecast the molds and then they work as you want to go?
Great question. So the initial visit, we take impressions, and then it goes onto a computer and a simulation, and then we actually have your case program from start to finish.
Yeah.
So typically what I end up doing is I give a patient, let's say, 4 trays. So I'll see them in 8 weeks.
Okay.
And sometimes 10 weeks. It depends on the case.
One of the cool things that we're talking about today, though, is the fact that obviously Invisalign isn't intrusive, but it's also able to be sped up now.
Absolutely.
So how does that work?
And then, so I'm going to show you a product that's called Excelident. It just recently came, it was FDA approved in Canada last year. And I'm going to just get you to try this. So basically what this does is, so remember I just said for an average year, it's 26 aligners.
Yeah.
You can cut that into half. So your treatment that would normally take a year would be 6 months. So for patients that have a treatment of 2 years, a year, that's very impressive. So let me just show you something. I'm actually going to give this to you.
Okay. All right. I'm going to Invisalign it up.
So this is a sterile one because I don't want to touch it with my hands.
As you can see, it has never been opened before, which is nice for me.
So just look at how this goes in. So there's like the rounded part here, and that snaps in like this, okay? So I'm going to get you to do that.
Yeah. Okay, walk me through it here. Like that?
Turn it upside down.
There you go.
Like that. Push it in.
All
right. And then basically you're going to push the button. You feel the vibration.
Do I put it in my mouth?
Yeah, absolutely. So put it in and you bite. So that's exactly it. So the force that you need to bite onto it, and that's 20 minutes a day. So you're wearing that for 20 minutes a day. How does it feel, by the way?
It's fun. It's not bad. It's not like it's giving me like blah, 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 blah. It's a minor little vibrate.
Right. So just to give you an idea, it's 30 hertz, and what does that mean for people?
What does that mean for people? Okay,
so it's 8 times less than an Oral-B Sonic Complete toothbrush.
Which I actually use, by the way.
Right.
They're fantastic.
They're amazing.
Yeah.
So this is 8 times as less. So this is 20 minutes a day, and then you're changing your trays once a week.
So what does that do though? Because for me, it's just vibrating, but there's obviously a much different, it's doing something.
Absolutely. So basically, just, you know, not to get too technical, but it's bringing cells to the area that help break down and remodel bone. As you know, like bone in our arms, our legs, it's not static, it's dynamic, it's always forming. It's breaking down, forming, breaking down, forming. So the same thing. So this brings cells to the area that helps accelerate that process.
When people are thinking about Invisalign, because I know braces are, I mean, you can fix a lot with braces.
Absolutely.
Is the same true with Invisalign, or does it have to be a lesser degree?
And you know what? That's another great question, because years ago when Invisalign first came out, it was just very few cases that you would actually pick. You wouldn't pick the complicated cases, jaw issues, canines, which are the eye teeth that are high up, sometimes left in the palate. So you wouldn't take on those cases. But pretty much today, you can almost take on every case. And in fact, there's certain cases that Invisalign will treat better than traditional braces, yes. So I'm not sure if you've ever seen those people, but for lack of better terms, it's called an open bite. So in
Okay.
other words,
Show me.
when they bite their teeth together, they're open in the front. So that's their bite.
Really?
Yeah, so it's called an open bite, and that's usually from thumb sucking or a tongue thrust.
You can't hide.
No, you can't hide, absolutely. So that keeps it like this. So the nice thing about Invisalign, because you're wearing these trays 22 hours a day, it actually pushes the back teeth up and over time will close the bite down for you.
Really?
Right, so you can't do that with traditional braces, or it's very, very difficult to do that with traditional braces. So in fact, this actually does a better job. And also for spacing issues where someone has a lot of spacing, Invisalign brings the case in very fast and smooth.
The teenagers must be loving this, because I remember the first day I got my braces.
Right.
It was hell week. I remember I was nervous, I was scared. Every time I played basketball, I was taking, it was constant. Is this sort of the cosmetic, non-invasive approach?
It is. And you know what, the thing is, Invisalign does a lot of their own advertising, so the public really is aware of Invisalign today. I mean, if I had my choice today, if I was going to get braces or Invisalign, I'd absolutely go Invisalign. There's no question about it. Because you know what, also the braces end up cutting your cheeks. I mean, you probably remember that, the wax and the cheek.
Don't even get me started.
You know, I still have scar tissue.
Yeah, I took a basketball to the face, and I remember I literally had a braces mark from the. Anyways, sorry guys. That's the thing about the couch; you never know what's going to come up.
Yeah, absolutely.
Okay, so for people at home, what age can they start doing this though?
So initially it was thought that, you know, you can do Invisalign where you'd have to get your second molars. And so if everybody knows what a second molar is, that's the second molar, okay? So the second molar would have to erupt. So that's typically at around age of 12, 13, let's say. Now you don't even have to have the second molar erupt. So you can actually start the case much earlier. You can do, some people are starting cases at 10, 11 years old.
Amazing.
The only, you know, the only downfall, if you will, is compliance. I mean, you have to wear the retainers 22 hours a day. So I'm not saying that braces will never be in existence and so on and so forth, but you have to choose the cases, especially with teenagers.
And you have to stay dedicated to it. You can't just get it, wear it occasionally, hope it works. For more information, where do people go?
They can go to the website at auroradentistry.ca or 905-503-7800.
Okay, perfect, guys. Coming up next, more Daytime York Region. We are talking to Floor Director Stefano about what else? The Montreal Canadiens. Oh, yeah. More Daytime after the break, guys. Don't go anywhere.